well. Today we'd like to discuss about scope of homeopathy in cancer cases. I'm practicing since 1984 and from very beginning I used to get many cancer cases in my practice. Initially once a month, then once a week. Now when I'm in other songs since last 4 years, maybe whenever I come I get some cancer cases. So I would like to share my experiences. Quite a few years I'm practicing, and what I've learned from my successful and failure cases, I would like to share. First of all, one type of cases can come where it is totally homeopathy. Patient doesn't want to undergo any surgery, no radiation, no chemo, totally on homeopathy. So I would like to share my experience of one such case. In 2013, I had case of thyroid cancer of this patient, but distinctly 3.2 into zero point 0.9 into 2.8 centimeter nodule was there, well-defined hypoechoic nodule and definite few oval sub-centimeter right cervical lymph nodes. So there were lymph nodes enlargement as well as a big nodule in the thyroid gland, 3.2 into zero point 0.9 into 2.8 centimeter. When patient came, tremendous care of cancer, few remedy we can share. Hmm? So, lot of fear of the cancer of the thyroid and death, lot of anxiety about what will happen to family. He loves nature. His brother had pancreatic cancer. Nothing else was available in the case, only this much information after spending 2 hours by me and by my resident. So my first prescription was carcinosin, family history, loves nature, and tremendous fear of cancer. Nothing else was available. In the next, after 15 days when patient comes, patient was complaining of only strong grief that he has lost his brother due to pancreatic cancer and he doesn't have any son, he has only daughter. So after her marriage, house will be empty. This is called empty nest syndrome. This interview, he didn't mention much about the grief, but he mentioned a lot. He didn't mention about the fear of cancer, but he mentioned a lot about this grief, especially about the brother's loss. So obviously remedy was ignatia. I started the treatment with carcinosin. At this moment, I gave ignatia. After 1 month, when patient comes, there is absolutely no grief, no fear of cancer, but he's just pointing out that nodule, what to do with that, this is enlarged, what kind of treatment can be given, why this is not going, it looks prominent, etc., etc. Nothing else is available, patient's affinity is in the organ. At this moment, I gave thyroidinum. One follow-up recording we could see. At present, I'm not sharing, but distinct swelling is there. My assistant that time, Dr. Manish, examined, and there was a distinct nodule present. After that, we did the investigation after this three remedy in April 14, few months after the treatment, and absolutely no solid or cystic nodule, and there was no lymph node enlargement at all. It vanished totally. After that, patient developed one bad spasmodic cough in an acute with yellow expectoration, suffocating cough, and neck cancer thyroid. So Dr. Manish gave Spongia 30, few doses, and then when patient came in April, absolutely fine, enjoying good health, no fear of cancer, he has gained weight, good appetite, and then somewhere in the month of December 2014, patient developed a lot of trust in us. Patient was comfortable to speak, and we took the whole case. We got many characteristic rubrics at this time, like grief elements from very strong desire for fish, Then perspiration staining the linen. One second. Yeah. Perspiration salty, perspiration stiffening the linen. These two characteristic symptom. Along with that, weeping, tearful mood. He always used to weep alone. He never wept in front of anyone. So all these rubrics were covered by natrum Moore. And if we see Ignatia and natrum Moore is acute of chronic. Ignatia is acute of chronic natrum Moore with that grief, hardly he speaks, his fear of cancer, desire for fish, everything matched with natrum Moore. So at this juncture, I gave natrum Moore. And latest follow-up was few months back. He's enjoying health, no fear of cancer, thyroid gland totally normal, absolutely fine, no issue anywhere, and every angle he's doing fine. So what do we learn from this case? We believe cancer is acute exaggeration of chronic problem. So whatever state is present, we have to treat the state. Initially, I didn't get natrum state, but this is a ladder pattern case. First, I got carcinosin, then ignatia, then thyroid, acute spongia, and ultimately natrum Moore, and then I didn't change. For a long time, even now, patient is on natrum Moore and doing fantastically well. So this is a case where only homeopathy and the role of homeopathy in handling the cancer. Another variety comes, for example, I would like to discuss this case, just a second. This is a tongue cancer. I saw this patient at Adersong Academy, again quite a few years ago. Very interesting case for me. 48 years male, consulted me with cancer of the tongue with lymph nodal metastasis. He had a very strong history of tobacco chewing, and biopsy showed grade 2 squamous cell carcinoma. On examination, it was found that half of the tongue was ulcerated, inflamed, disfigured, and patient was very much concerned about saving the tongue. And I remembered, I referred the case to the oncologist, a very famous oncologist of Bombay, said immediate operation. And that means for the lifetime he will not be able to speak, lifetime he will not be able to eat, and whole thing will be very disfigured. So he was in a very, very upset condition. And then at that condition, what to do, how to handle this situation? Because already lymph nodes are involved and tongue is already half is lost with distinctly, you can say, very active cancer. And a renowned oncologist is advising immediate operation. So I gave him nitric acid 3C, one homeopathic remedy which has local affinity for the cancer. This I have learned from Dr. Banerjee when I was with him, or I was learning with him. So I gave nitric acid 3C for 7 days, and I told the patient, after 7 days you meet the oncologist. And after 7 days when patient met this particular surgeon, he was very impressed, so much improvement. He said now there is no need to operate, but radiation and chemo will be required. But tongue operation is not required. Ultimately, his main remedy was calcarea floor because of many issues, many characteristic symptoms. But he did so much better when the tongue was saved. And in one of the follow-up, his wife mentions that if tongue would have been removed or operated, a lachar jindagi he had to live. That maybe we can see it in the follow-up, we can observe that in testimony. But the main feeling in this case, what is my satisfaction is, I could save his tongue. Patient has taken chemo, and we have got very beautiful medicine to nullify the side effect of chemo. I have proved uranium nitrate. It has tremendous weakness, nausea, vomiting, fear of death, all whatever side effects of chemo produces, uranium nitrate proving at same state. So in 90% cases I have seen, if I give uranium nitrate 31 dose before and after, it really nullifies the side effects of chemo. So while taking chemo, patient took uranium nitrate, and when taking radiation, patient took cobalt nitrate. Cobalt nitrate is very specific to nullify the side effect of radiation. Sometimes X-ray also, sometimes radium brom also. So here in combination with allopathy, homeopathy saved the tongue, whatever best I could do, which was very, very important for the patient, and whatever best I can do for the patient in other signs also. So radiation chemo was also given, and at present patient is enjoying life. Maybe 3 years have already passed, and we can see the testimony how much satisfied patient is and how much happy he is, because we could save the tongue from a very simple treatment of nitric acid 3C for 7 days. And best part is his latest investigation report. It shows that totally whatever the lymph nodes enlargement were there and whatever the cancer was there has disappeared totally. If I could see it, I will just see. Yeah, all reports were definitely clear, and he took 4 cycles of chemo, cisplatin and paclitaxel, and 29 cycles of radiation. But in spite of that, with homeopathy, he could tolerate it so well that there was no problem at all. It is a false belief that if patient takes chemo or radiation, life is finished. There is no hope. Radiation and chemo is very toxic. Not like that. In my understanding, whatever best we can do, homeopathy, allopathy, Ayurveda, yoga, diet, spirituality, music, everything should be encouraged. And if we integrate all, success rate is much, much better.
कैसे हो प्रदीप जी?
ठीक हो एकदम।
क्या क्या चेंजेस हैं अभी? पहले बात तो मुंह कितना खुलता है तक?
मुंह इतने खुल रहा है
नहीं, पहले से काफी है।
पहले से अच्छा खुल रहे हैं।
मतलब पहले जो स्पून तक नहीं जाता था अंदर, अब तो वो अच्छे से जो अपना सूप का स्पून रहता है ना, उसे सूप पी लेते हैं। पहले वो ग्लास में लेके या सिपर से।
जीभ बताओ बाहर आता है बाहर
थोड़ा।
ओके।
वो अभी ये सब साइड इफेक्ट कैसा है, वो सिर्फ दांतों का ज्यादा प्रॉब्लम।
दांत का
बैंड।
हाँ बैंड।
नींद आता है बराबर रात को?
हाँ नींद आता है।
मूड ठीक है?
कौन सा
मूड? मिजाज?
हाँ मिजाज तो ठीक है, मिजाज तो
नहीं, ये भी आपकी दवाई ने उसको एनहांस किया। नहीं तो कैसा है कि मैंने काफी पेशेंट देखे, इवन मैं 2-3 डेंटिस्ट को नासिक में दिखाई, तो सब लोग बोलते हैं कि कोई ऐसा विश्वास नहीं करेगा कि ये इंसान कैंसर से मतलब रेडिएशन हो गया है या कीमो हो गया है, कि इनको देखे। क्योंकि कैंसर के पेशेंट देखे तो एकदम डिप्रेस रहते हैं और इतना स्लगिश हो जाते हैं कि उनमें उतनी ताकत नहीं रहती। मतलब वो हंसते वसते तो है ही नहीं वो।
अकॉर्डिंग टू यू मई 2012 आप आए थे फर्स्ट टाइम में भी अदर सॉन्ग में,
या
और आज में क्या चेंजेस है? 1 साल से ज्यादा हो गया मेरे साथ हो।
1.5
साल।
क्या चेंजेस है? मतलब लाइफ बच गई है, ये सबसे बड़ी बात तो यही है।
मैं बोल सकता था वो एलोपैथी में भी बच जाता था, तो होम्योपैथी का क्या?
नहीं, एलोपैथ में शायद वो डॉक्टर टंग काटने को कहते, तो शायद ये फेलो कभी बात ही नहीं कर पाते। ये तो होता ही था।
फर्स्ट विजिट में सुल्तान प्रधान वही बोला था ना?
बिल्कुल सर, आपने मेरे को 7 दिन बोले थे कि 7 दिन उनसे मांगो। 10 दिन आपने बोले थे, हमने उनको बोला था, और वो बोले 7 दिन के अंदर अंदर आपको ऑपरेशन करना चाहिए, कि मैं कोई रिस्क नहीं लूंगा और ना मेरी तरफ से मैं आपको कोई दवाई लिख के दूंगा कि आपको अर्जेंट अपॉइंटमेंट लेके ऑपरेट करना पड़ेगा। फिर वहां से निकल के हम लोग सीधा आपके पास आए थे, तो आपने मुझे कहा था कि एटलीस्ट 10 दिन दोगे, कितना है उसमें इम्प्रूवमेंट आता है अपन देखेंगे। और आपने जो कॉन्फिडेंस से कहा था ना सर, तो उसी दिन मुझे ऐसा था कि नहीं, ऑपरेशन नहीं होना है। मतलब कॉन्फिडेंस, आपके वर्ड्स में इतना कॉन्फिडेंस था। इवन सुल्तान प्रधान को बाद में दिखाया था, तो वो भी शॉक हुए थे कि ऐसा कैसा हो सकता है। कोई पेशेंट जिसको मैंने कहा था कि ऑपरेट करना है, उन्होंने खुद ने, सभी डॉक्टर्स ने उसमें लिखा ही है, एक्सेलेंट रिजल्ट आया है, एक्सेलेंट रिकवरी है। वाड़वानी सर तो हमेशा लिखते थे कंट्रोल्ड,
और कुछ
नहीं, और तो कोई ऐसे शब्दों में मैं कह सकूं ऐसा नहीं है। वो फीलिंग्स वर्बली आई कांट एक्चुअली एक्सप्लेन।
क्या क्या बोलना चाहते हो मतलब?
नहीं, वो शब्दों के बाहर है सर। नहीं तो मैं सिर्फ सोचती थी कि आज इंसान अगर टंग काट के बैठ गया होता तो आज सब लोग, हम लोग तो इसके ऊपर जैसे ही हमको गाली देते, कल को बच्चे को गाली देते, मैं चिल्लाती रहती कि ये तुमने क्या कर दिया। अगर बेटा ऐसा इतना लाचार इंसान हो जाता, न बिजनेस कर पाता, न घर चला पाता,
बात ही नहीं कर सकता,
बात ही नहीं कर सकता था।
खाना भी तो दूर की बात है ना।
बिल्कुल बात नहीं कर सकना, और लाइफ टाइम के लिए बात न करना, ये अपन सोच भी नहीं सकते।
ओके, और भी बहुत इम्प्रूवमेंट होगा, आई एम कॉन्फिडेंट।
This particular, when I took the case, I was very touched with the pathology. 48 years lady comes to me with cancer lung, mediastinal adenopathy, and metastasis to brain also. Shocking, it is already lung is affected, mediastinal adenopathy is also there, and brain is also affected. So in short, there is a lung, brain and mediastinum. Again, patient took 4 cycles of cisplatin, radiation 10 cycle to the brain, and one oral chemo, Gefinib, that also patient was taking. Again, I gave uranium nitrate 30, and this also I learned from Dr. Banerjee, Ruta G6C. It strengthens the telomere of the chromosome and it prevents mitosis and meiosis. So Ruta G6C, whenever there is an advanced pathology metastasis, I give it instead of placebo twice daily. And retrospectively, whenever I see the cases, whenever I present it for seminar or anywhere, wherever I have given Ruta, results are very good. So I gave cobalt nitrate also to nullify the side effects of radiation. I gave uranium nitrate to nullify the side effects of chemo. By her nature, she had certain features of Barrett's curve and certain features of stramonium. For example, she depends on husband for support and responsibility, strong fear of ghost, fear of alone, fear of darkness. These are stramonium feature. Desires ice cream. So these are radium brome feature. So I gave radium brome, and after the treatment, investigation shows significant reduction in extent and metabolic activity of the primary right lung, reduction in the activity and size of the mediastinal adenopathy, paratracheal and bilateral supraclavicular adenopathy has completely resolved, rim enhancing cerebral and cerebellar lesions are no longer appreciable. So, on 6 June 2012, investigation of PET CT was neither brain cancer, nor mediastinal cancer, nor lung cancer. It was very, very encouraging. Then I gave few other remedy like carcinosin lung, which has organ remedy. 36C I had, Ruta G continued. And the latest follow-up, maybe testimony we can add, where she is telling, इन हिंदी शी से मुझे मालूम भी नहीं पड़ा कहाँ से मैं केमो लिया, कहाँ से मैं रेडिएशन थेरेपी लिया, मुझे मालूम भी नहीं पड़ा. Hemoglobin is also improved. She started gaining her hairs. She is full confident. Initially she was afraid of alone. Now she could go anywhere. She could do household works. There is a very big change in her mind also, and she is enjoying life. What do I learn from the case? Again here, in spite of taking allopathy, surgery, homeopathy played a very important role to nullify the side effect and to prevent the relapse, and combined with homeopathy and allopathy in such an advanced case where there is a brain metastasis from lung or vice versa, patient did so much better. Again, it is a learning experience. If you take chemo and if you take radiation, life is not finished. But in a better way, if you can combine all three, if you can integrate in such an advanced case, result is fantastic.
कैसे है?
अब अच्छी हूँ, पहले से बहुत बेहतर है. और आपके दवाई से ये हीमोग्लोबिन वगैरह कुछ भी कम नहीं हुआ. केमो हो गया तो भी कम नहीं हो गया. थोड़ा बढ़ा ही है। और बाल भी पूरे गए थे केमो की वजह से, तो बाल भी अभी आ रहे हैं। और दवाई से तो बहुत रिलीफ मिल गया मुझे इस ट्रीटमेंट
किसमें रिलीफ मिला?
वही मुझे थोड़ा सा ये आता था, चक्कर आता था, तो वो भी अभी खत्म हो गया। वीकनेस भी बहुत था, वीकनेस भी अभी अच्छा हो गया।
तो मेरा मेडिसिन का रोल क्या हुआ आपने? होम्योपैथी का रोल क्या हुआ?
होम्योपैथी का रोल तो
क्योंकि मैं बोलूंगा केमो भी लिया है, तो मेरा मेडिसिन का केमो भी लिया, रेडिएशन भी लिया ना?
हाँ, केमो भी लिया, रेडिएशन भी लिया। केमो के भी जो टैबलेट्स आपने एक पहले दिन दूसरे दिन दिए थे, उससे भी केमो का बहुत ये कम हो गया। और केमो का जो ये आता है खाने का पीने का, तो उससे बहुत कम आ गया। जो वोमिटिंग होती है तो वो भी नहीं आई मुझे आपकी दवाई से।
और रेडिएशन का?
रेडिएशन का भी कुछ परेशानी नहीं हुई। वो तो एकदम ठीक हो गया। कुछ पता ही नहीं लगा रेडिएशन दिया इसका।
और कुछ?
और तो फीलिंग तो बहुत अच्छी करती हूँ, वे सब पूरा घर का काम करती मैं। जो खाना बनाना, सब उठा के रखना वगैरह, सब चिल्लर काम सब कर लेती मैं। अब बाहर भी जाके अकेली जाके आती, पहले अकेली बाहर नहीं जाती थी गांव को वगैरह, तो अभी अकेली मैं जा सकती हूँ।
सब रिपोर्ट्स भी अच्छे हैं?
हाँ, रिपोर्ट्स भी पूरे अच्छे हैं। अभी खाली एक टैबलेट्स दे दिया डॉक्टर ने, अब पूरा बंद कर दिया। और आपका दवाई चालू है।
Again, this case, she is a mother of one allopathic doctor, I think child specialist. I was seeing her at BAPS hospital at Ahmedabad, where I go once in 2 months as a consultant, and I do lot of difficult cases there with collaboration of allopathic hospital. This lady had cancer, breast surgery done, chemotherapy given, and when she came, she was very sensitive, very weak, loss of appetite, lots of stress about husband being cheated, main feeling her name and reputation will be affected, lot of anxiety about family members, helping others if someone is hungry. But the main, how does she differ from others in this case? From childhood, she was very sensitive to poor people suffering, and from childhood she has struggled a lot in very difficult situations. She had to struggle a lot. This is her feeling, to come out of the poverty as a child, and very sensitive about the stories. Many stories she said where there is a lot of struggle and lot of poverty, and how someone comes out of that. She relates herself in childhood where lots of adjustment were to be done. So all these rubrics like clairvoyance, sympathetic, anxiety for others, desire ice cream, desire salty food, points towards phosphorus. But I gave her acid phos because in Fatak, if we see, quite unwilling to speak, indifferent to everything, and apathetic from unequal struggling with adverse circumstances. This was exactly her feeling, unequal struggle with adverse circumstances. So I gave her acid phos. Follow-up was very much better. But what I did in this case was, she preserved her breast cancer operated mass in paraffin blocks. So I prepared the medicine from the same tissue. I sent it to Calcutta, one Homeo International. They prepared the medicine in 3200 1M potency. If I want to give 1M, according to Margaret Tyler, I will not give 1M straight away. I will start with 30, first day 3 times a day, second day 200 3 times a day plussing method, and third day 1M 3 times a day plussing method. Plussing method meaning you take the half water from the bottle. For example, you take 60 ml water, put the medicine, shake it, take half the water, fill it again with the water. This is called plussing method. At afternoon, take half the water, fill it half. At night also, Either you take it because next day you are starting with next medicine. So plasing method is diluted. It is not LM potency, but in water we dilute it. So this way 30, 200, 1M every month was given, and she did very well. All the follow-ups, energetic, active, lot of energy. And very recently I saw her maybe 2 weeks ago. She has gained her hairs, no weakness. In acute, whatever the side effects of chemo was coming, that is nullified, and she is really enjoying. Her doctor's son is narrating the improvement, but after giving carcinosin from the same tissue, results are fantastic. So various way we can combine the knowledge of homeopathy with allopathy, with integration of allopathy, and results are much encouraging. What I've learned, initially I used to do only homeopathy. In many cases I saw when cases are advanced, patient in general better, but there were many failures too. But now if I if case is very advanced and if I combine both, results are really good. If some patient doesn't want to take allopathy at all and wants to take only homeopathy, that is also welcomed. What I do on merit, I refer to the like-minded oncologist, and if they advises some chemotherapy and radiation, if I feel that is justified, how strongly, how confidently that doctor is telling to take chemo and radiation, and if it is justified, then I give my medicine plus to nullify the side effects of chemo and radiation. And if we combine all three for the benefit of the patient, results are fantastic. And as such, we know homeopathy aims at immunity, homeopathy aims to prevent the relapse. One of the strongest cause of the cancer is inward unresolved grief, and homeopathy can definitely address that. But no harm if we combine all three and whatever we do for the benefit of the patient. That's all I would like to share today. Thank you so much.